Do you actually know what's in your favorite over-the-counter pain reliever? Turns out only 41% of people read the label according to a new study. So Dr. Travis Stork is here to tell us how to stay safe while treating our aches and pains. You probably see Travis as co-host of the daytime medical talk show, The Doctors, which we watch in our offices immediately after the early show is over. Doctor, good morning. Welcome.
Thanks for having me. I appreciate it.
The numbers from this kind of interesting. 41% of people don't read, which leads you to the conclusion if they're not reading it, then they may overdose because they don't know how much is in it. And that's a big danger.
Well, it's a big danger. And I think back to before I went to medical school, and I would go to the over-the-counter shelves and grab a few things here and there. And I had no idea what was in them. But if I asked you to close your eyes and gave you a bunch of pills and said, Jeff, take these, would you?
Of course, because you're the
because
doctor
I'm a
and you prescribe
physician.
them. But I get what you're saying.
But we're going into supermarkets, pharmacies, and we're taking all these different medicines. We don't know what's in them. This study was funded by Tylenol. It found that over half the folks didn't know what the ingredients were. But furthermore, people didn't know that the active ingredient in Tylenol is acetaminophen. Yeah. Advil and Motrin, the active ingredients, ibuprofen. So it's basically the same thing. And they're basically taking more of the exact same class of medication than they should. That leads to dangerous problems down the road, can lead to liver failure, amongst other things.
And some are anti-inflammatory, some are pain relievers. With acetaminophen in particular, the liver damage is potentially something to watch out for.
Shockingly, acetaminophen has become the #1 cause of acute liver failure here in this country. And unfortunately, that's due to many times accidental overdoses. Over half of these are due to accidental overdoses, and that's because over 600 medications, prescription and non-prescription, have acetaminophen in it. So if you're not reading the label, you could be taking 2-3 different medicines with acetaminophen in it, causing liver damage and not even know it.
The problem sometimes is not just taking that one medication, it's taking 3 different medications that you think are all different but all have the same ingredients. Let's talk about, you got to watch out for yourself first of all when you're taking these medications. But then one of the big concerns that we've talked about here, and it's for my wife and I, when we're giving my son something, he's 18 months old, when people give their kids doses, how to make sure you're giving the right dose, because this is something you're even more worried about. You actually have an example here to show what people can give and how people sometimes mistakenly give out the wrong doses.
A lot of times the wrong doses, and a lot of times if a medicine says fever reducer, parents need to know what is that fever reducer. So I have 4 different teaspoons over here. So if it says, oh, give a teaspoon to your child, you can tell that these all give a very drastically different amount of medicine to your child. So what happens is over time, over 3-4 days, your child's sick and you're giving them a quote-unquote fever reducer. Yeah. And if you're giving them a teaspoonful that's not actually a teaspoon, you could slowly be giving them a toxic dose, causing major problems.
Because those are all spoons, they're just not all teaspoons.
Don't use spoons to measure your children's medicine. And the other crazy thing is infant drops may be more concentrated than the actual children's syrup. So you can't mix those up either. And this is just really a call to parents out there. Pay attention to the labels. And we as an industry need to do a better job of labeling our medications as well so that people know, hey, this is the active ingredient. This is the exact dosing. Because for kids, dosing is based on weight. Yet a lot of the bottles will say give it based on age. But if you have a very small 2-year-old, you don't want to give them a standard 2-year-old dose.
Talk about potentially a universal symbol for some of things like acetaminophen. Before we go, I want to talk about being the CEO of not just your household, which you've talked about before, but also your medicine cabinet and knowing what you want to do. So what does that mean, being the CEO of the medicine cabinet?
So be the CEO of your own health. You need to know the ingredients in the medicine you're taking. You need to know the proper dosage to make sure you're not getting a toxic dose. And then also know the side effects, because if you have a history of kidney problems, you probably don't want to take ibuprofen. Discuss it with your doctor. Liver problems, talk about acetaminophen with your doctor, because these things do have side effects. You want to make sure you know with your physician what the best medicine is for you.
And no using spoons at all.
Spoons are a bad call when it comes to medicine.
By the way, you just got engaged. Congratulations.
Thank you. I appreciate it.
Well done. Dr. Travis Stork, you can see him on The Doctors.